as you all can see, we have a diverse representation here of geriatric experts, so which is really fun. I do thank Betsy Usher for putting this panel together. I do want to start off with, I think, Catherine, I think perhaps we can ask you about this, Catherine and Kimberly. Before going live here, we were talking about older adults and how with COVID, oftentimes they had different symptoms than younger folks. So I was wondering if you two could speak to perhaps what some of the more common symptoms are in older adults, and when would somebody know that they need to take their loved one to the emergency room or even call their healthcare provider?
I get a lot of referrals I've noticed lately where I'll get referred for changes in mood, changes in behavior, increased confusion, agitation, withdrawal. Just something seems off. And sure enough, we'll see them typically test positive, within a day or two after that. And I feel like there's kind of, when we think about standard delirium type symptoms, something just seems very different. So when you're noticing mood or behavioral changes ahead of time, that might be something to kind of keep an eye out for. But then also I'll kind of pass off to Catherine for more of those traditional symptoms that we think of across the board as well.
Right, so we know the traditional symptoms of cough, inability to smell, new fever. One thing to remember in an older adult is that fever can sometimes be blunted. So while we may see in a younger person a fever of 101 or 103, even a fever of 99 can be really meaningful, or sometimes older adults don't mount a fever at all. So don't take for granted just because there's no fever that there's no COVID involved. That could definitely be an issue. The other is the GI symptoms. Don't forget, a lot of people are truly presenting only with nausea or diarrhea. And that's something to look out for as well if that's presenting new. And it's important to be very careful with that because an older adult can be dehydrated very quickly especially with diarrhea. So that's something to watch carefully for and make sure that if they can't keep fluids down, that would be a time you'd want to get to the ER and get some hydration in place.
Great, thank you. And I think that's some really great points there that older adults, especially with the delirium, this acute change in just the way that they're able to care for themselves, or even just a drastic change from their everyday personality or ability to function. I know that we do have some older adults and some caregivers that are really fearful to take mom or dad to either the emergency room or either perhaps to a medical appointment because there's some fear of exposure to the illness itself. And Mira, I was hoping that you could speak a little bit about telehealth, what you were doing with telehealth, and maybe even the possibility of telehealth across the US, and how you can skirt some of those concerns about being more exposed to the virus when you're going to a healthcare setting.
Yeah, definitely. I feel like traditionally with like telehealth, we don't think like geriatrics, right? Just because they may not have like the technical capabilities and things like that. But, we've been able to like rely a lot on their caregivers and identify people who would have tech devices of like a tablet or maybe just their cell phone. Some people have a desktop that we're able to kind of get them set up on like a virtual visit and identify that they can do that. And then in some situations, we've also been able to deploy tablets to their home. So then they are set up with like video capabilities. And so then we can try to run, a visit as close as possible, because we actually have quite a few patients, elderly patients, who are concerned about coming into the clinic. Of course, like being exposed to like other people, around them. Of course, like we try to reassure them that like, we're taking all social distancing practices and sanitation and things of that nature. And when we invite them into the clinic, we want to make sure that they're safe and just providing that reassurance. But patients still want to opt to actually do telehealth visits. And I think they got introduced, or I know know, they got introduced into this concept more so when everything hit in March, and a lot of the nation just had to flip and like figure out how do we keep everybody safe. And as we're going through this like learning curve, you know, and so from that, we were able to learn a lot, and so did our patients, to be like, wow, this actually isn't as like difficult or challenging as they thought. I think it was just at least having like another touch point or a blueprint really to map out a plan, you know, because it's really about being able to communicate with our patients, like having that access to care. And I know right now a lot of like our healthcare system is pretty strained on all levels, you know, trying to even get in with your primary care face-to-face or specialists. And of course, like we're really trying to only send serious cases to the hospital systems, where like for us in our company, like telehealth has been like that support system and that overlay, because you know, we still encourage, like I said, like all patients to come in clinic if that's what their preference is, but we have had to scale back a little bit in terms of how many team members can we have on site, just to like make sure we're also taking proper precautions. And so that scales back a little bit of our in-center capacity, but with telehealth, we're still able to reach those patients and have that communication with them. I think one of the benefits of telehealth that we've also been able to do is like really utilize like our resources in the community too, so that we can try to mimic more of like in-center visits in the sense of like if they need labs, point of care testing, things of that nature, we've been able to send a lab out or get them scheduled quickly just to come out and get their labs done, that kind of thing. And also just like educating them about how to also empower their own health, of monitoring your blood pressures at home and your blood sugars, because like all of these chronic conditions that our elderly patients have, we still need to manage them quite well, you know, and how do we do that in this like new setting? And so it goes back to a lot of education and empowering the patients to kind of start to take charge of that if they weren't already doing it, just because a lot of you know, the ER and things like that aren't able to take like, you know, our serious cases of our chronic complications, you know, so we've been able to kind of like help offset that. And then of course, if there's anything where we see in telehealth, we're like, that needs like a little bit more of like a thorough physical exam, like we're not really able to fully assess that, we get them set up with an in-center visit to kind of help support that discussion and kind of like dialogue with their PCP too. So I definitely see a lot more evolution, because I feel like we've grown and changed a whole lot, because, you know, something that would probably take like 5 to 10 years to go telehealth, we did in the matter of like 3 to 6 months, you know, across the nation, you know, and I think that's incredible and gives more light to where we're going to see this go in terms of more remote monitoring devices that we can kind of get involved in patients' care, and getting that information within the home and making them feel comfortable within their home and feeling safe. So I think all of those practices have been really helpful in telehealth and being successful with the geriatric population.
Great. So would you say that for the clinicians who are watching, or even students who are watching who will be clinicians, do you feel pretty confident as a clinician doing telehealth and being able to navigate somebody's chief complaint, or to be able to point them in the right direction to resources?
Yeah, definitely. I feel like you're able to get like a pretty decent understanding and history from the patient. And of course, if like a caregiver's present, they're always like providing like much more information. And if we may not be able to like get the right answer right then and there, we can deploy the resources that we need, you know. For example, like today I saw a demented patient who was kind of precipitating with maybe like a UTI, where she was having some frequent falls, a little bit more agitation, and we were able to send home labs to her house to get a UA and kind of get her treatment up pretty quick. So we're able to kind of mimic those things and provide that care like with the virtual setting, but also getting resources deployed to her home. So I definitely think like in situations like that, where we don't want it to go undiscussed for too long, and then she's going to the ER for more complications of that, which we see a lot of our patients going to the ER for untreated UTIs.
Thank you. That's good to know that, you know, you feel really confident taking care of pretty complex older adults through that telehealth medium. Becca, I did want to ask you, because we have a lot of folks watching that are thinking about how do you balance risks versus benefits of even going to a physical therapy appointment or going to an appointment with your healthcare provider. If you can walk us through what would be the best way to go about that? What are the risks? What are the benefits?
Only that was an easier question to answer. From the point of view of someone who has worked primarily in the settings of elective surgeries and procedures, all of which do pose this serious risk because of COVID, but which also inhabit a very gray area in terms of care, it's easy to deem something like a knee replacement surgery or a steroid injection as non-essential. But delaying treatment of pain or mobility or whatever the procedure is designed to help treat can also have serious long-term effects on patients' physical health and quality of life that can have really long-term repercussions. So probably the most important part of that decision-making process takes place well before patients ever get to see me. And I know it would be easiest to say, well, we should postpone all elective visits and have everybody shelter in place all the time. I think that's a really important conversation for a patient and their families to have with their primary care provider to weigh those risks and benefits. Just if only because these procedures take place in such high risk environments and high exposure environments. So it's important to think about things like, even if these visits are in environments that are technically safer than the hospital, like a surgery or a private practice, there are still a lot of risk factors associated. Like, is the unit where the procedure being performed isolated from COVID treatment areas? This could be more likely in a hospital or a surgery center, but is going to be much less likely in an office or a primary care setting. And other questions to talk about with their primary care provider would be, does the facility have visitor and masking policies? Will the patients be screened before the procedure or on arrival? Can you fill out necessary forms online prior to the visit? Are staff being monitored for symptoms? Questions like that can really help patients and their families make that decision. But ultimately, the choice to make is really up to the patient and their family, and deciding, okay, how much do I think I will suffer as a result of delaying this care? But it is, if patients do decide to go forward with that care, it is important to make sure that both the patient and their family have time to learn and familiarize themselves with the treatment facility's expectations for protection and preparation for the procedure, because that's likely to have drastically changed from the last time they were seen. From a provider's, sorry.
I was going to ask you, from the provider's perspective, what additionally should providers be doing to make sure that the environment that they're in is safe for patients? And I guess what extra things should they be doing? And for the providers who are on the call, and then also for those who have family members, what would they expect that a provider would do extra to make sure that their loved one's safe?
In terms of safety, I think it's making sure that you do take the time to go over the risks and benefits with your patient, and to understand that if your patient decides to not take that risk and not undergo that treatment, anticipate that those patients are going to require treatment for the symptoms related to not getting that procedure, increased pain, decreased mobility, things like that. And just making sure that your patients know, hey, you've got to let me know. Don't be shy about communicating that your discomfort is going to increase, maybe dramatically. Pain crises are a reality of both post-procedural, that post-procedural time period, and something that can come up as a result of postponed procedures. So providers do really need to be ready for those when they ultimately happen. But I think communication is key in this case.
Yeah. Any other thoughts from our other panelists on that?
I definitely agree.
Oh, great.
I was going to say, I definitely agree with what Rebecca said. Just from like a primary care standpoint, we're always talking to our patients and evaluating them about like how severe their symptoms are, and how much that's going to affect their quality of life, and kind of outweighing the risks and benefits. But I think just having that shared decision making is like super important. And then I think it's also kind of like knowing your geographic location access, because I know a lot of our specialists are pretty full pull with patients and things like that, and being able to also understand what's like an expected timeline for them too, if they do decide to kind of go for an elective procedure for them. So I think like our PCPs, you know, should be pretty well versed in kind of understanding a little bit of who their network is and how quickly they could even get in if they do want to go with elective procedures, that kind of thing. So I think it's good insight to just open that dialogue and have that conversation.
Great.
Yeah, I would say we're in this for a while, right? So I don't think we can just outright say, I'm going to wait until this is over. So the shared decision-making piece with the family, the patient, and the provider are all very critical. And other things to consider are, what are your alternatives? So if I don't have this procedure, is there something else I could do? For example, you're due for your colonoscopy. So could you potentially do a screening kit at home that might buy you some time until you can, buy yourself a year until you can feel more comfortable having the colonoscopy? So there may be other ways. It's just important to have that conversation.
I would say too, if whatever procedure is going to require, let's say, skilled nursing rehab. I don't know if everyone knows that these centers are required to report. You can usually go on their main website. There's a widget or a dashboard typically on the homepage, which is going to list the number of staff that have tested positive, they're actively positive, that are actively recovered, number of patients that have tested positive, that are actively positive versus recovered, number of deaths. And you can see those details probably through the Department of Health website, but you can see them on the homepage of these centers as well. So if you know that you're going to be looking at skilled nursing rehab as well, do a little bit of research as far as, COVID cases, you should have access to that information, and feel free to ask those questions because it's out there.
That's a great point. I would say too that I've had, being in long-term care myself, I've had people ask me if the number of COVID cases is related to quality of care in the nursing home, and my answer is no. We see breakouts in centers that have fantastic care. So, which is just unfortunate that there's that myth out there. But as GMP, I can tell you that there really is no correlation. And we actually have seen some new studies now that are showing that as well. But definitely asking, the long-term care facility, how they go, what their process is for screening patients as well as caring for patients with COVID. So one thing that we have seen a lot in long-term care, and that I know a lot of family members have seen in their loved ones that are isolated at home, is there's this really concern for their cognition is worsening and they're getting depressed. Also, there's this concern that patients, their frailty or maybe their pre-frailty is really becoming amplified. So I know, Kathy, I was wondering first if you could speak, and then Kimberly, if you could also speak, and the other panelists, about what are some things that seniors can do while they're at home, quarantined or even in isolation, to keep their mind active or even to keep their body active, so that, so they're taking steps to really avoid frailty.
Unmute myself. So to me, it really starts with helping older adults understand upfront why it's so important. And so frailty frailty is a state of vulnerability, and it reflects the very slow and gradual loss of strength and energy over time as we age. And that's happening really, our peak functional capacity is around age 30. And we slowly lose about 0.5 to 1% per year until we reach the end of our life. But we begin to really be aware of it, I would say, probably in our 60s. We know we can't do what we could before. And then that continues to decline until an older adult reaches a point where they begin to lose the ability to do things that were once very common activities. So helping them understand what's happening. And so I like to teach it from the standpoint of helping them understand at a very simple layperson level how their body makes energy and how they can do things to slow that down and to increase their strength and increase their energy levels. And I'm going to share my, if it's okay, if we have time, I'm going to share my screen and show some of the things that we're teaching. Can everyone see that?
We can see it, yeah.
Okay. All right, so that's a common question. Why are we seeing COVID so much more in older adults as compared to younger adults? And I like to talk to older adults about it from this perspective of how their body makes energy. We're seeing more and more research come out on this whole topic of aging and why older patients do so much worse with COVID. And it really, I'm not going to go into this slide, but it really, aging affects all of these systems in the body and all of these different comorbidities. And then when COVID comes along, it has an effect on all of those things. So we teach it this way, that COVID is a deadly virus that hijacks the cells of the body, and it basically steals their energy. And their immune system is unable to respond. It has a very high energetic cost. And we depict it as their body has these 3 energy tanks. They have the essential one that just keeps them alive. They have the available tank that's for the basic things that they do from day to day, but they have this other tank that's a potential that we use whenever we need more energy, when we exercise or have things that require more energy. And so what we show is that when COVID comes along with the younger person, it begins to steal their energy, but they have enough and they're able to recover. In an older person, those tanks are much lower and they don't have enough energy to recover, and oftentimes they become depleted. And so what can we do about it? And we teach in that physical activity is the very best thing that we can do that creates a demand for more energy. So what you're looking at here is a drawing of a mitochondria. And we teach about mitochondria, and we teach that they're like little energy engines in the cells of the body, and that when we engage in physical activity, that we can keep them, we can maintain the number and the quality of them, and then that they work better. And so I think I'll stop there. So that's how we show that. I'm trying to see if I can stop sharing my screen. Let's see. Move this. There we go. Right. So we find that when we help older people understand why it's so important, that in itself is more of a motivator to make them want to engage in physical activity and in activities to maintain their cognition. And so from that standpoint, I think the most practical things that you can do to help them determine what works for them that they can do on a day-to-day basis, and not only get themselves to do it, but things that they can enjoy, practical things, dancing to music, walking, figuring out a walking path in their own house, and having 3 times a day that they do it. I had one older person tell me that they take a deck of cards a couple of times a day and they toss it up in the air and let it just fall all over the floor. And they pick them all up one by one, stoop and pick them up one by one. And and they do it a couple of times a day for physical activity. So
I need to do that. Kathy, I wanted to ask you, as well as the other panelists, there's a real concern about older adults who have survived COVID being able to rebound physically as well as cognitively, mentally. Approximately how much time is that taking seniors to rebound, just an average senior?
Well, some of the other panelists are going to be able to speak to it firsthand from having their patients, but it seems to have a lot to do with the viral load that they were introduced to. And the higher the viral load, the worse they do, and the longer it takes them to recover.
Yeah. Anyone else?
I think some of that is left out to kind of see as we keep going. But I've seen some patients with that fatigue and lethargy for several months, kind of depressive symptoms for several months. Things like taste, appetite, I tend to see rebound pretty quickly, even a few weeks after they're considered recovered. Physical weakness, several weeks. But that mood and low energy, I've seen it now taking, I usually say 1 to 3 months, you know, really giving some time for that body, for their bodies to recover.
Wow. And Kimberly, can you speak to the social isolation and cognitive decline, depression? I know that we're all really concerned about that for our seniors who either are rebounding from COVID or those who are isolating at home. What are some ways that we can look out for seniors, and maybe some ways to prevent it, to treat it? It's just such a big issue.
Yeah, I think for at home, there are some really great, you know, if you really want to get involved with technology, but the technology has to be easy to use. I love the Alexa kind of video screen type products where you can just say call so-and-so, but it's a video chat that sets up, they're not having to deal with a smartphone trying to figure out what number to dial. You can give it a pretty simple command, write the command and stick it on the device, you know, so they can find, what do I say to it? Okay, this is what I say. But it gives people ways to communicate kind of in person like we're doing, but much simpler. You're not pulling out a computer. I found these picture frames that they're interactive, and family members from anywhere can send their pictures by text or email. So all they have to have is that picture frame up in their home, and any moment, you know, different pictures are coming up from family, wherever the family is, and they can kind of see that. And that's a neat way to interact. We have a touch lamp with, you know, my color's green. So when we touch it, the different people in our family with that lamp, their lamps turn green, and they know that we're thinking about them. But it's a way to always interact, even though we're all stuck in our homes. And I've seen some amazing creativity in the long-term care center as well. But I typically have conversations about, well, what did you do before? How did you visit before? You know, and so one example, family love to have coffee together. Okay, well, have their coffee delivered, have the staff give it to the patient, and you bring your coffee. And even though it's a window visit, you're still having coffee together. So ways that you can still mimic those same types of visits that you had together before, and those same interactions. It just takes some creativity, but you can still do it.
Sorry, I'm on mute. I need one of those shirts. You're on mute. I did put something in the chat. Something I've personally worked with is NixPlay technology that I work with my own in-laws, where I send them pictures off of my phone and it goes directly to their picture frame. They get excited when there's a new one. So that's great. And I know a lot of seniors also that are in long-term care, they get that as well. So they're able to enjoy their family at a distance. So that's great. Wanted to ask you all too, we did get a question, which I think is a really good question, about mask wearing. Some patients with dementia who just either won't wear masks or can't wear masks. How would you navigate that with a family member or with a patient who has dementia who is not wearing their mask appropriately?
So Jenny, I'll jump in. The first thing I would say is don't create a battle over the mask with someone with dementia, because those just tend to escalate. And so the important thing is to remain calm and not create it so that you're fighting over, you have to wear the mask, you don't have to wear the mask. But some strategies I would say are thinking about the type of mask. So the masks that tie in the back might be better, or even if you have one that has the earlobes, if there's something that you could use to tie the earlobes back so that it stays on a little bit more secure. The other is to put a lanyard on the mask. So if the mask does come off, it doesn't hit the ground, it doesn't get gross from being everywhere, it just stays around the neck. So it's a little bit easier to keep hold of. And obviously make sure that everybody else around is wearing their appropriate masking as well, so that everyone can stay as safe as possible. It's not going to be a perfect science with someone with dementia, and I think you just have to get a little bit comfortable with that imperfection and do the best you can with the strategies that work for that person. Everybody's going to be a little bit different.
Great. Anybody else on our panel have anything to add to that? I do agree, Catherine. It's not a battle. We have some patients that just will never be able to have that on, and don't create the battle. And there can be so much tension related to that. Wanted to also talk about, we had a great question that came in recently about what are the current recommendations for nutritional support for the immune system for people to protect them against COVID, or maybe if they have found themselves testing positive for COVID, what are some nutritional support supplements or even treatments that one could take at home, or if there's any kind of expectation in long-term care facilities?
I think one of the hardest areas for older adults to get the nutrition they need is with their protein intake. I mean, really, all of us, we would be surprised if we looked at how much protein we take in each day. We're probably all deficient, but so to be able to for the immunity, for the resistance to the virus, we need those proteins that are going to break down into those biochemical components that are so essential. And so in addition to, chicken and fish are great sources of protein, but also those, the protein drinks that you can buy, they taste pretty good, and they have about 30 grams of protein in one. So that would be, one of my recommendations for nutrition.
That's great.
I was going to say, I know across the board, if we feel like there's a possible exposure, we're testing vitamin D levels and automatically implementing vitamin D supplementation, which is found to be pretty helpful. And again, that's helpful for mood as well. So, it's a good one to kind of keep an eye out and automatically consider supplementing.
Mm-hmm. That's great. I know some facilities also, when patients are testing positive for COVID, starting them on a vitamin C regimen, the vitamin D, like you said, Pepcid or famotidine, although there's new research to show that you really shouldn't start that. If somebody's taking it, that's great, but shouldn't start it. And just, really encouraging nutrition. But, kind of along the lines what Catherine was saying, we have some patients with COVID that just won't eat because nothing tastes good, and not really creating a battle out of that. What I've told some patients who have COVID or won't eat, if they're drinking, that's great. At least we can you can keep yourself from being dehydrated. But luckily in long-term care settings and hospitals, we have other avenues to hydrate with IV fluids, but obviously we don't have that in the home. Wanted to ask you all, in your areas, are any NPs or MDs doing home visits? And what does that look like? How would a patient here that maybe is listening to this, how would they go about finding somebody to come to their home to do an evaluation?
So I would say if you have a Medicare Advantage plan, then there almost always is someone who's willing to do a home visit, either in the home or virtually. So I would encourage you to call your plan, ask that question, and see if that's available to you. If there's not someone from the plan that can come out, there generally is availability to look for people who have that home visit availability. There are a lot of companies doing this work now, either as primary care or as urgent care. So, and depending on what area of the country you're in. So for example, there's a company called Dispatch Health, and they provide urgent care visits in the home with nurse practitioners and physician assistants right there for you. And they can even do IV fluids and a lot of the things that would normally be done in the hospital. So sometimes it's just simply making a phone call and asking, or even doing a quick Google search to see what's available in your area. This is a really growing area in healthcare, home visits. And it would be, you know, they're obviously in rural areas that may be a little tougher, but in a big metro area, more than likely you probably have someone, if you're a Medicare beneficiary, that can come out and provide you with a home visit.
Great. I do have a couple of colleagues who do home care, and anybody here, if you're wanting some ideas about that, please feel free to email me and I could give you their information. And usually the only barrier is if they don't accept your insurance, but you're right, Catherine, it's really just a booming area for obvious reasons. I do want to switch gears here and talk a little bit about the vaccine, because everybody's talking about the vaccine. People here in Nashville are getting vaccinated at the end of the week, and we're really excited about it. I'm excited about it, at least, and I know there's also healthy skepticism amongst others. Catherine, if you could start off the conversation about I guess where people can find good information about the vaccine, and then maybe if you can speak to, is it effective? What can we expect in the future? All of those fun things.
Yes, this is, I think, the best Christmas gift we could have ever received, or holiday gift, is this vaccine. So I'm sure, as you all know, we have one approved vaccine right now, the Pfizer vaccine. This vaccine is 2 doses. It is very important, and the Moderna vaccine, which will likely be approved in the coming days, is also a 2-dose vaccine. It is critically important to receive both doses of the vaccine. So if these are vaccines that you do choose to take, they are 2 doses. And so the Pfizer vaccine is 2 doses 3 weeks apart. The Moderna vaccine is 2 doses 4 weeks apart. So make sure you get that second dose is critical. You don't have immunity the second you get the shot in the arm, right? So you do need to you need to continue to take the same precautions you were taking before. You need to mask, physically distance, and good hand hygiene. All those pieces don't change. And until we really have herd immunity, that is something that we will need to continue to do as a society. So even if you're vaccinated, we still don't know if you are potentially a carrier of the virus and could spread it as well. So we will not stop what we're doing necessarily. We will, but until we get to that herd immunity piece. I encourage everyone to get the vaccine. They are safe. These first 2 vaccines are 95% effective. These are new technology vaccines. They're not typically what we have seen in the past. However, they are tested in the same way that vaccines have always been tested. So this is not, we didn't skip steps in the process. It was just that everybody stopped everything else they were doing and simply focused on this. And that's not something that we've traditionally had the urgency to have to do as a society. We also spent a lot more dollars in order to produce vaccine that we assumed would be effective. Had it not been effective, we obviously would have had to toss a lot of vaccine. So there's a couple of things that went into why this came so quickly, and it wasn't because steps were skipped. So I think that as providers, we are very comfortable with vaccine, and I would encourage the public to be comfortable with the vaccines as well. We do have a couple more vaccines coming on the heels. Most of them are 2 doses. There is one vaccine produced by Johnson & Johnson's division Janssen, and that is a 1-dose vaccine. We anticipate seeing that in probably the first quarter of 2021, assuming that those trial results continue to look promising and they're able to get the traditional approvals as well. So right now, you're seeing your healthcare workers and long-term care facilities getting the vaccine. You can go to the CDC website and you can see the prioritization. And it's very clear it's going to be done by the states. If you're not sure where you fall into that, you can look at it on the CDC website. I would encourage everyone, the CDC website has a phenomenal amount of information, not just about the vaccine, but about anything else you may have questions around COVID. There's tons of great resources there. So I would encourage you to take a look at that. And but the states, really and truly, the states are the ones distributing. So also look at your Department of Public Health websites, and that will give you some other information about where the vaccines are going when. Ultimately, the hope would be probably early next year, maybe second quarter, we will start seeing vaccines in CVS, Walgreens areas where you can actually walk in and get a vaccine yourself.
Great. And I know that CVS and Walgreens, at least in the state of Tennessee, they're responsible for going to the different long-term care facilities and distributing that and giving those vaccinations. So if any of you are looking for an RN job, or if we have any pharmacists that are watching, CVS is hiring. So because so many people need to be vaccinated, I just got an email today. So not that they're not paying me to advertise or anything, but I just know that we, and of course we need to, always promote those things. But any other things that you all have discussion about the vaccine, about maybe other places you can find good information, trustworthy information about the vaccine, because there's so much on the internet, and you never know what you can trust and what you can't trust. I will tell you, there was a great presentation that's on, it's uploaded to YouTube now, that was done by Vanderbilt. I think it was in the Chancellor's series. Dr. Dennison gave a great 1-hour presentation on the vaccine and discussing the science behind it. So if you're interested, of course, Betsy Usher is going to provide an email address at the end of this, and you can email us and we can give you the link to that. But it's fantastic. He does a great job explaining it, about the science behind the vaccine and why you really should be vaccinated, and maybe some of the detractors, if you're thinking about natural immunity, what you would really need to think about, what could be harmful about that. So I did want to talk a little bit about perhaps what your nursing organizations or organizations that you are involved with. What kinds of things are you all doing to help, I guess, meet the needs for patients with COVID, or even trying to prevent the spread of disease in this population?
So, Jenny, I would say most of the societies, and actually that's another great resource in addition to CDC and other university websites. If you want, the nursing and medical society websites also have a lot of great reputable information. There's toolkits available to help educate providers as well as the public. Most of these organizations have been working hard also with in the policy arena as well. So advocating for the providers and the patients in order to ensure that the vaccine and other treatments are all distributed appropriately, and that everyone's getting great information at the same time. So there hasn't just been a vehicle for information. But I would also say that these societies have been a great support to the healthcare community throughout this pandemic. It's no secret that our healthcare workforce is just crushed right now. And so there have been a lot of resources deployed through those societies for the health and emotional support of the healthcare provider teams as well.
Yeah, I would second Catherine's comments about CDC. That's where we got all of our information that we've been teaching older adults. It's really explained in a really lay-friendly way, all the way from the most common symptoms to the more unusual symptoms, preventing the spread, why face masks work, good depictions of why they work and why social distancing works. When people understand the reasoning behind it better, they're more likely to follow precautions.
I feel like every day I say this, but I think it makes a difference when we all really reinforce with one another that we're all in this together. And we're all going to get through it together. And I think as nurses, we're educators, we're advocates, but we're cheerleaders. It's not easy. It stinks. We're over trying to appearances when you've got a shield and a gown and a mask, and all you can see are eyeballs every day. And it's hard, and it's been going on now for so long, but I think going in with a great attitude and saying, we're going to get through this together. And we can do this, and reminding patients that you're not alone. We're right here with you. It makes all of the difference in the world. So.
Yeah, I agree. How are you all encouraging your patients as well as the families and the caregivers? I know we're seeing so many discouraged family members, especially being in long-term care. They have not had visitors in months. I guess I'd love to hear from you all. What are some great ways that we can encourage families and residents and patients, maybe even just some easy ways that you even have encouraged your patients and even caregivers who are just, they're tired, they're exhausted, they're emotionally drained. What are some things that we can do?
I can share. So I have a project going on right now in a senior apartment community. And we originally planned to do this health and wellness program face-to-face. And then COVID hit. And so we were able to get iPads for all of the seniors living in this apartment building. And needless to say, there was a huge learning curve in terms of their digital literacy. Needed a lot of training, and I can say something about that in just a minute too. But so we got the program underway, and we were just delighted at how much they enjoy getting on Zoom and hearing a little talk, you know, whether it's about physical activity or nutrition or relationships in community or mind-body health. Very interactive. Everyone gets engaged. They all comment. They all, you know, give great feedback. And it's been a really good thing. So I think that, you know, more of that's needed, especially when they're, you know, at home and can't get out. You know, programs like that are really, really needed. And I wanted to mention that, so here in Nashville, the Nashville Public Libraries have a digital literacy program for seniors. And so if anyone's interested, so they provide training, you know, to older adults in the use of, you know, electronics. So just to let everybody know that might be available in other cities too.
How would we go about finding information about that training? Do you know if it would be on the website or?
I don't know if it's on the website. You can contact me and I can give you the contact information for the, you know, for Nashville Public Libraries. You probably could call and just inquire, but you're welcome to reach out to me too.
Wonderful. I do know that there's some high school programs in our area, at least, where the high schoolers are teaching older adults about literacy, or digital literacy, excuse me. And actually, when I was at the pharmacy, this was probably a year ago, there was a gentleman behind me who said that he had been to a class at the YMCA. And that was run by teenagers. That was kind of part of their community service, and they helped him set up his iPhone, and he loved the interaction. But so I think that we're seeing more of that as well, which is, of course, I just love that the meeting of those two generations. I think it's just fantastic. So any other ideas about, you know, just encouragement or just practical, easy ways that we can encourage everybody affected by this?
I would also want to mention that don't forget about your area agency on aging. So this is an organization in all 50 states that helps to connect to community resources. So it's a great benefit and it's free. So that's something that you can always look up and Google. It's in every state, and they can help also connect to other helpful resources as well.
I think as a mental health provider, these are conversations I have all day long. In checking in with staff, how are you doing? What are you doing to get rid of your stress? How are you taking care of yourself? Are you sleeping? But also with families, let go of the guilt. You know, we could find every reason in the world to feel guilty about something. Caregivers, that's probably the #1 emotion they experience. And you got to let go of it because it doesn't do you any good. It doesn't do the patient any good. You made your decisions, right? They were the best. You thought through it. You stood by it, and it's okay. And whether they're in long-term care or they're in the community, the quarantining requirements are basically the same, you know, as far as safety. But again, that we're all in it together. And let go of that guilt and try to find those positive things that you can see in all of this and focus on that. And it's just a conversation worth having every single day with your patients and families.
Great. Any other thoughts? We have just a couple of minutes left. We could talk forever. Right. Well, we've covered a lot in this hour, but of course, we could probably keep talking more and more because there's so much to talk about. I really want to thank, first of all, the panelists for coming and for sharing such great information. Also, a big thank you to Sarah Putnam and Betsy Usher for putting this panel together and organizing all of this. Wanted to let you all know that we're going to have another session, the Alumni Speaker Series, in January. So it will be on the topic of the Black population and mental health. So you could be looking forward to, if you follow us on social media, you can have all that information. We're, I think, on every social media outlet that there is, or you can always email us as well. But I believe that, Betsy, you're going to provide a slide here with an email address. If you have any further questions or comments, you can definitely direct it to any of us or this email right here, and they can get in contact with us. And Betsy, are you good? There we go. Oh, Sarah's sharing it, so. And I think I've got some things in the chat here. Great. Well, wonderful. Thank you all again for joining us. Be safe, be healthy, and I hope you're having a wonderful holiday season and a happy 2021.
Bye, everyone.
Bye.